The effect of lateral hip self-mobilization versus posterior anterior self-mobilization on hip extension, range of motion, and jump height in healthy adults. A double-blinded exploratory randomized control trial performed by Brittany Doyle, Michael Haberson, and Anthony Figueroa. Literature review. Lubert et al. In 2013 provided a descriptive study that measured femoral translational glide in vivo study during a posterior hip joint mobilization. They put a force equal to half of a person's body weight and distracted the joint 2 millimeters, which was the maximum joint capacity. Raymond and Matheson et al. In 2013 was a study on a variety of self-hip mobilizations in a home exercise program, and it was clinician guided. The clinicians used ropes and weights, but had a high variability. Urs et al. Performed grade 4 PA to A mobilizations to improve glute max strength. The results were an increased force production and joint accessory motion. The Lubert et al. Study was the foundation of our study because we used it to determine the amount of force in the bands that we used, which we will discuss later. Purpose. Restricted femoral acetabular joint mobility has detrimental effects on the lumbar spine, hip, knee, ankle. Joint mobilizations are widely used by physical therapists to increase range of motion. Mobilizations with movement are also used to treat a variety of musculoskeletal dysfunctions. Self-mobilizations with mobility bands have gained increased popularity over the last decade. The aim of our study is to determine the effect of lateral hip self-mobilizations versus posterior anterior hip self-mobilizations on hip extension, range of motion, and jump performance in healthy adults. Hypothesis. Research hypothesis. We hypothesize that PSAM, which is our posterior anterior self-mobilization, will be more effective than the LSM in weight bearing in improving jump height and range of motion in healthy adults. Our null hypothesis, there will be no difference between PSAM and LSM in weight bearing in improving jump height and range of motion in healthy adults. Sampling. Exclusion criteria. So since we are using mobility bands, we couldn't have anybody that had a latex allergy, no previous fractures or surgeries to the hip, knee, or ankle, previous injuries within 1 year to the hip, knee, or ankle, pain with squatting or jumping. Some inclusion criteria was healthy individuals between the ages of 18 and 35, residing in New Jersey and New York. We used convenience sampling. We went to 2 gyms. Dominican College, we used the DPT cohorts. Gym owners and managers were the notified members of our study, and we used snowballing sampling, which helped to recruit other participants. Extraneous factors. Range of motion variability at the hip joint, difficulty maintaining balance, band strength, type of mobilizations performed, fatigue, coordination, competition amongst friends, and BMI.
Equipment. A just jump mat, Rogue mobility bands, goniometry, an electric scale, and plastic dowels were used throughout this research experiment. The just jump mat was found by Leard et al. To be both valid and reliable at predicting jump height and when measuring it. The Rogue mobility bands are used frequently in gyms and in physical therapy settings and have standardized weights for elastic potential. A 65-pound bands and 100-pound bands were used throughout the study. Goniometry is found to be a useful way of measuring joint range of motion. Methods. The research design was a randomized controlled, double-blind exploratory study. IRB approval was achieved before the study was began. 60 participants were selected between the ages of 18 and 35. The study included 29 males and 31 females. 2 mobilization glides were used, a lateral self-mobilization and a posterior to anterior self-mobilization. 2 researchers were blinded while 1 researcher was not. Researchers number 1 and researcher number 2 were in charge of data collection and collecting of objective measurements. Researcher number 3 assigned participants randomly to their mobilization groups and instructed in both the posterior to anterior self-mobilization and lateral self-mobilization. Interventions. A posterior to anterior self-mobilization and a lateral self-mobilization were instructed to each participant by the researchers. A pre-selected written dialogue was given to each one, so that way the instructions were consistent for each one. Dowels were used for both mobilizations, so that way trunk extension or flexion could be avoided throughout the mobilizations. Determining band resistance. In order to achieve a mobilization force that is equal to half the person's body weight, rogue mobility bands were used. Rogue mobility bands have a rest length of 41 inches. When the band is stretched to 1/2 its rest length, 61 inches, it has the amount of elastic potential as determined by the company. So, a green mobility band, when stretched to 61 inches, will have a force of 65 pounds per force. A black band will have 100 pounds per force. In order to maintain proper mobilization groups, 6 different groups were determined based off of the participant's body weight. Each participant was randomly allocated to these groups based off of their body weight through a computer algorithm.
Data analysis. We analyzed the data using SPSS software 25th edition. We utilized the mixed design 3-way ANOVA and identified 2 independent groups as our interventions, which was the lateral self-mobilization group and the posterior to anterior self-mobilization groups. We utilized gender as another independent variable, and our 2 dependent measures were pre-post range of motion and jump height. Paired T-sample and independent T-sample tests were done to determine the differences among gender. Confidence interval of 95 and an alpha level of 0.05 was used. Our first table here shows a group demographic breakdown. There were 31 participants in the lateral self-mobilization group, 16 being female, 15 being male. 29 participants were in the posterior to anterior self-mobilization group, 15 were female and 14 were male. Across both groups, there had been a similar mean age of 24, and their mean weights were also similar, being 168 pounds. Because our mean age and mean weights across groups were very similar, it indicates that we had a homologous sample. We also were able to identify that 80% of our participants participated in physical activity approximately 3 or more hours a week. The second table shows gender demographics within the study. There were 31 females and 29 males, with a mean age of also 24. But the differences were in weights, where females weighed a little less than males at 142 pounds, while males weighed at 195 on average. This first chart gives us an idea of the overall difference in range of motion from pre to post. Overall, there was a significant increase in hip extension range of motion from pre to post intervention, indicating that our intervention may have increased hip extension. Now, as you can see in this chart, there was an increase in range of motion post-intervention between both groups. However, that increase in range of motion was not significant within the group, nor was it significant between the groups. The next chart gives us jump height performances. Now, jump height performances were greater among the lateral self-mobilization group, but again, there was no significant differences between pre to post or between groups.
Discussion. Based on the results of our study, we've decided to accept the null hypothesis and that no statistical difference was found between mobilization groups for jump height and range of motion.
Overall, there was an increase of range of motion post-intervention, and average jump height, there was an increase with the lateral self-mobilizations.
Some additional results that we found were gender differences, and there was also a mobilization trend that we'll discuss further. So as we said, there was some gender differences that we really didn't expect. So although there was no significant difference in post range of motion or jump height within or between our intervention groups, there was a significant difference between males and females. Males had a greater hip extension range of motion, but was not significantly different from pre to post intervention. Males, on the other hand, Now, in regards to jump height, there was no difference pre to post intervention between groups or within groups for jump height. However, within both groups, there was a significant difference in jump height between males and females, where males had a significantly greater jump height than females, and the lateral self-mobilization group, their jump height performance was greater than the posterior to anterior self-mobilization group. So finally, we also did a correlation analysis on band resistance, and we found that there was a negative correlation between pound of force and the post-intervention range of motion. So the scatter plot indicates that as the pound of force decreased, post-intervention range of motion increased.
In a case study by Schwartz, Strack, Analog, and Brewster that looked at 5 athletes with hip and lumbar mobility and motor control impairments, they created a treatment-based classification breaking down each impairment groups into acute, subacute, and participation phases of treatment. In the acute phase of treatment, all participants received both manual and self-mobilizations that they used. While this was only a small part of the case study, their outcomes found significant improvement in range of motion, strength, pain, and special tests using the Fair-Fader, squeeze test, curl-up test, as well as functional testing related to athletic participation. Overall, there was a decrease in pain by greater than 2 points, a decrease in outcome scores, which also allowed them to maintain their performance in sports.
Conclusion. Self-joint mobilizations caused an increase in hip extension. There was also a correlation between force and the effectiveness of the mobilization. We noticed that with the increased force, there was it had a negative effect on range of motion or jump height. Gender differences between mobilizations and range of motion was observed. There was no improvement in jump height post-intervention, and no significant differences were seen between the lateral and the posterior anterior of self-mobilizations. Future research should analyze gender differences and force prescription for self-mobilizations versus manual mobilizations. Relevance. Self-mobilizations are widely used by rehabilitation clinicians, especially physical therapists. This is used to increase muscular strength and improve accessory motion. Few studies were analyzed the efficacy of self-hip mobilizations. There were no studies to our knowledge that compared the posterior anterior self-mobilization to a lateral self-mobilization. And other studies, there were no studies to our knowledge that created a standard force of distraction. This would guide future research and compare gender differences with self-mobilizations using mobility bands.
We just want to thank everybody that made this study possible. Rogue Bands for providing the bands to us. Dr. Udir for helping us through this whole process. Dr. Primatera, without him we wouldn't be able to understand any of the data that we collected. Angelo and Joseph for opening up their gyms to us. And Gary Schiffman, as well as Rebecca Wright. Without her, we wouldn't be able to understand any of the math behind the band resistance stuff that we collected as well. Thank you very much for all your help.